Hi, friends. We are back again at Soaring Through Chaos, another episode. And I'm always looking for people who, when we talk about crisis, when we talk about chaos, we always have this notion that we should somehow survive or maybe bounce back. But there are scientists, there are doctors, there are therapists who say it's when we are in discomfort, when we are out of our comfort zone, that's when we finally find a way to leapfrog. In other words, how we can soar, how we can thrive. And one of the people I've seen thrive multiple times is my friend, Dr. Anurag. Um, Anurag, tell us about you. I don't want to brag about you. Just tell us what your life has been like and in what ways some of the things that you went through brought you to where you are today. The global outreach person for biodesign at the design school at Stanford University, among many other things that you've done, many other outreach and things you've done for the community. Just tell us anything about you.
Thank you, Shankar. First of all, thank you so much for having me on. And it's remarkable what you do. I've known you for a very long time, much more than a decade, maybe 15, 16 years. And the thing that have amazed me the most about you and Seema, of course, are the ways you found yourself, working for the betterment of society in so many different ways, not just professionally, but outside of your professional life. And, you've had a number of transitions in your own sort of journey, but I've seen you move more and more towards a societal solution for many of the challenges that we face. And for that, I really thank you. And it's an inspiration. The conversations with you are always make me pull me out of my comfort zone. And it's I'm always trying to be uncomfortable, and opportunity to talk to you is always fun. So looking forward to this conversation as well.
Well, thank you. You are very kind. But this talk is about what Anurag Mairal has done for the world and continues to do. And it's definitely not a competition. We are all in it together. There is so many needs, both personal, interpersonal, and global. And we are in one of the most challenging times for all of humanity today as a collective. That's why whatever you're doing with COVID, whatever you're doing to keep people informed is very, very helpful.
Thank you.
So,
I have this philosophy. I'll just say that up front so that kind of will tie everything together. I have a very, very utilitarian view of humanity, of who we are and what we are meant to do. We are asked this question, or we ask this question to ourselves, what is my life meant for? What are we here for, right? I have a very simple answer to that. It's like we are here to contribute any which way for the betterment of all of our fellow human beings. That's our job. If we can do that well, we'll find happiness. And trust me, everything that I've done since I've figured that out has really been fairly joyful, and it hasn't felt like work. I mean, I would say last 15, 20 years have been in that frame of mind. So, and I say that to my kids as well, and I think they have started to understand what that is. And the reason I gave your and Seema's example is in that same light. So I'll just share very briefly what my journey has been like. So I grew up in a small town in India called Raipur. My parents were teachers, and education was very important to them, as is to a lot of parents in India. Had a fairly big family. We have 3 brothers and a sister, extended family, and grew up in the small town really as part of a community, growing up with the community. And I did my undergrad in Raipur as well, in the engineering college there. And then I went to IIT Bombay, got my master's. I knew that I wanted to get higher education, so I came to the US for my PhD, did a couple of postdoctoral fellowships, and I was destined to be a professor. I wanted to be in academia, I wanted to do research. And somewhere along the way, I realized that just doing research isn't going to be sufficient for me. I wanted to have a much closer engagement with things that saw the light of the day, that had an impact on customers, people, industries. I wanted to see application of things that I was working on. I didn't want to just write papers. That wasn't interesting enough for me. So my first job in the Bay Area was at a small company that was fast growing at the time, a membrane technology company. And while I was working there, I decided to get an MBA at House School of Business at Berkeley, which is where I met you for the first time. I met Seema before that, but I met you there. And that really changed the trajectory of my life. So that was my first. So my first transition, media transition, was when I decided to go to an industry job rather than going to an academic job. And I had a number of academic positions lined up after my postdoctoral fellowships. So going to industry was the first turn for me. The second turn was when I decided to do an MBA, and I realized that business problems interested me quite a bit, because I realized that as an engineer, I found the scientific or engineering challenges to be much better defined. They were easier to solve. There was often an answer at the end of that exercise. But business problems were fairly unique, and they were open, and they were poorly defined. So I went into business side of things. I was at a medtech company, Johnson & Johnson, for some time. Did product development, I did business development, marketing, different roles. And that's when my transition from a chemical engineer that did some life sciences work to fully in the health technology happened. In 2007 was another major shift for me. I got an opportunity to become a faculty member at Stanford Biodesign, which is a medical technology innovation program. And I had to really think hard about that, whether I wanted to do that, full time. I wanted to leave J&J. I decided to do that. I left J&J. But I didn't want to do biodesign full time either. I wanted to have a role in the industry that gave me that flexibility, because if I worked at J&J full time, I couldn't really do my Stanford role. So my deal with Stanford Biodesign was I was gonna spend half my time there working on this new program that we were creating in India called Stanford-India Biodesign. This was Stanford Biodesign's first global initiative. And we didn't know whether this was going to be successful or not, but I wanted to be part of that, and I was fortunate that they thought I could contribute. But the other part that I got involved in simultaneously was a strategy consulting firm focused on medtech industry globally with an organization called Orbees Medical. So I co-founded that. So I split my time between those two. I've continued to do that for the last 13 years. I've done a couple of things in between, but those two have been my main jobs, if you will. In between, I did a sabbatical for a couple of years. I worked at a nonprofit organization called PATH, which is a fairly successful, very large nonprofit, works in about 70, 80 countries. And my role was in the leadership of devices, diagnostics, and digital health. Three of the modalities they worked on, really focusing on underserved around the world. So that really was a big shift for me. Before that, I was working on mostly medtech for the developed countries, the US, Europe, and so on. Working at Stanford Biodesign with India program, and then being exposed to global health at Biodesign, and then moving to Path's role, that really was a big shift for me. And honestly, I think this is probably a permanent shift for me. I probably will continue to work on underserved health technology needs for the rest of my career, rest of my working life, I think. So that's what I've been working on last few years, I would say 8-9 years. I have some advisory board roles in some of the nonprofits. I serve Path's Bay Area Leadership Council as the chair of the Path's Bay Area Leadership Council. I'm on the advisory board of Seva International, where I focus on high school kids. That's actually really a big passion for me. And few for-profit organizations as well. But that's really a range of things that I'm involved in.
So before I said I will talk to Anurag for this interview, because I've known you as a friend from the Berkeley days when you were at Haas School, and I had no idea. I thought you're an undergrad doing an MBA. Later, I find out you're Dr. Anurag Mairal with many years of research experience, but you're just down to earth, and that's why I could see your childlike innocence, if I may say so. So I said I'll do a back of the envelope calculation. My estimate is that you probably work 36 hours a day. And given that you're doing it at double speed, you probably work 18 hours a day. There's no way you could be doing all these things that you're still doing, whether it is the biodesign school at Stanford, the outreach, also teaching at IIT Bombay. I believe you're a visiting faculty there. And
Yeah, I don't have a formal role yet.
yeah,
I probably will take one at point, but I am teaching a course there right now.
you're giving guidance directly to the students at IIT Bombay, and then you've got Pat as an advisor and advisory council and many other things. How do you manage? And you have, I know you have a 2 or 3 year old child. Is that
Three and
right?
a half year old,
How do
yes.
you
And
manage
he
all?
may come into
Plus
the
you have
room anytime.
teenagers. Plus you have
I do
teenagers.
have, yes, well, I have a 21-year-old who is about to be a senior at UCSB, and I have about to be a sophomore. I guess already a sophomore because he's doing summer term at Berkeley, and who's 19, and I have a 3.5-year-old.
Yeah, fair enough. How do you manage? I mean, I know Sukhada is very patient, your wife, but how do you juggle so much? And
I
what's
think
the
this,
secret, if I may ask? I'm not a
what
big
is it?
believer in juggling, but
You
I'm
should
not good
share
at
your
it.
secret.
I'm not a good juggler. I do one thing at a time usually.
So I think that's a great question. I think I learned time management when I was at Berkeley. I
Uh-huh.
realized that I was working full time. This was a evening and weekend MBA program. So I was doing that, and I had taken a consulting role with J&J at that time. So I was doing 3 different things at the same time. And I realized when my MBA was over, I suddenly had a lot of time on my hands, and I could do multiple things. And I was involved in theater and other things. So I think I just enjoy doing multiple things. I feel that I have a lot of energy, and I think we're very fortunate. To be honest with you, I feel very fortunate that the organizations allow me to do what I am able to do. I think you did mention one particular individual and there are some individuals that in my life that allow me to play these multiple roles. So one of them is, of course, my wife, the most important one. Sukhada has been amazing. She is, even though she complains every time I take on a new thing, she does go along with it, and she's very supportive. And I try to be as supportive of her in return. But honestly, I couldn't do a thing without her support. My kids have been very understanding, and they are very cooperative. So that's a second group of people. The third one is my co-founder at Orbees. He's been very generous with letting me do other things while he's the CEO of Orbees Medical, and I'm able to do things that I do really well there, and still be able to do other things. And my partners, my fellow faculty members at Stanford. So I think the secret that I've learned is that find people who are like-minded, who are passionate about things that you do, who are willing to work with you. So in every single job everything that we talked about, the range of things that I'm involved in, I have at least one individual in that organization who was my partner in crime. So that's a secret, really.
And there are many. We have Silicon Valley is full of high achievers, including Elon Musk, who runs 2 to 3 companies sometimes, and accomplishes. But what I find different about you, Anurag, is your commitment to compassion. You have always taken on projects such as guiding high school students, such as working with the underprivileged. How did you get into that? Because from a quote unquote success perspective, you got all the badges, right? But what drives you to work towards supporting people, and what's in it for you, if I may ask that American
Yeah,
question?
no, it's a
What's in it for
great
you?
question. No, it's a
Huh?
great question. That's a great question, actually. And that's a very important question, I'll tell you. And in fact, high school kids that you're talking about, when I mentor them, I tell them they're some of the most amazing people I've ever met. These high school kids, you should meet them next time you're in the Bay Area. Phenomenal, very mature, very committed, very driven, and it's an honor to actually mentor them. But what I tell them is that it's a privilege. Actually, it's a privilege to be able to work with those that need our help, because it makes our life meaningful. I mean, you could chase a professional career. You go in your organization, be a manager, a director, a VP, a president, or CEO. You could be all those things, and you'll get a lot of joy from that, just being successful at that. But the joy that you get from being able to make an impact on somebody else's life, it's a completely different order of magnitude. And I discovered, I was lucky. I discovered that some time back, and as I mentioned, my mom and dad were teachers, and I was a tutor for many kids when I was in college, and I've remained a teacher of some kind throughout my career, and I already saw how much of an impact a teacher makes on somebody's life, and it made me feel really, really good. So you asked me, what is in it for me? Oh, joy. I mean, I could do this all my life, and I will never be bored. I will never be sad because I'm always ready to do this because it's just so much fun. You know, maybe financially it may not be as rewarding always, and that's okay because I think how much money do you really need? Unfortunately, I have jobs that pay well, so you know, but it's not even about that. So even if it did not pay well, I would still say this would be a worthwhile thing to do because it's just a lot of joy. I mean, so it's very selfish, to be honest with you. I could say that I do it for philanthropic reasons. I don't. I do it because it gives me a lot of joy because I see a lot of folks around me who probably struggle with the sense of purpose in their lives. I ran an MBA admissions and career advising firm called Gurumi for 9 years, and I had a lot of mentees who I would work with and who would struggle with that question. And I helped them think through what they could do that so that they felt their life was more meaningful. And I think it's a universal challenge for all of us. Our society has been structured around, you know, excelling in academics, excelling in careers, and nothing wrong with that, but it doesn't give your life full meaning. So I think it's just being, you know, this stuff is very meaningful. It's so much joy. I mean, you've discovered that yourself, so.
Yeah, in my case, there is a specific reason why I get motivated to support people who are less, you know, who don't have enough. My father was a postman, and we didn't have enough in terms of financial or physical resources. But the government of India, and there are so many charities, I'm talking about the 1970s and 80s, they funded my entire education from middle school, high school, college, IIT, and later when I even went to Stanford, I was good at getting subsidies. I'd mastered the art of free education. And as
That's
you know,
awesome.
all you have to do is an assistantship, a research, and even seek at the Center for Compassion at Stanford. They gave me a, you know, 1 year with some of the best compassion teachers for under $5,000, and I didn't even need the scholarship. That's the greatness of it. When somebody gives you the tools to survive and to thrive for so little. And the reason I say $5,000 is because we were all working professionals 20, 30 years into our career. So it is time to give back in a big way. But which raises the question for me. You have all these, you know, you have all these responsibilities. And then I see you doing a lot of things for COVID that you're actually actively participating in. I don't know exactly how, but I see you posting, I see you monitoring, I see you even advising on what can be done with COVID, giving your 2 cents worth. Tell us about what's going on. How are you
Sure.
able to manage time? And what do you think people should do during these times when a lot of us are panicked, not just for health, but economic reasons, loss of jobs, and
Yeah.
also losing their balance of mind? What can we
Yeah.
do during these times?
Yeah, I mean, this is COVID-19 is probably the most significant event of our lifetime for our society. It's actually the most significant event for many generations. I would say in the last 100 years, even exceeding what happened with Second World War, what happened with First World War, what happened with the 1918 Spanish flu, misnamed Spanish flu. You know, we are in a very different place in our evolution of our society, and the isolation that this imposes on our society, and the reversal of a lot of global sort of community building that we were on, it's just unprecedented, and it has health impact, it has economic impact, it has social, mental, cultural impact. The world is going to change so much as a result of what's going on, that if all of us did not come together to think about what that future is, and put our hands together to address this crisis right now, but also prepare for what that uncertain future is going to be. There's a very interesting experiment that I've been running called rubber band experiment, where you have a rubber band. As a result of this crisis, it's been stretched, and now the question is, what's going to be the post-COVID world? Is it going to stretch back to the original state? Is it going to stretch and return to another state, or is it going to remain in a stretched position for an indeterminate time? And for the longest time, people were saying it's going to come back. Then people said, oh, it's going to come to another steady state. Now, a lot of people are actually, choosing the third option, that it's going to remain in this uncertain, dynamic, changing phase for a long time. And I think we need to find a way to help each other, to our society, to come together and help our society in dealing with it in any way we can. And the people who are getting most impacted are people who are underprivileged, people who are at risk the greatest, whether they're old, they're vulnerable from health point of view, economic point of view, people of color. I mean, this has just been, this has actually sort of separated out the haves and have-nots even more. So I'm in global health, so COVID-19 actually is right up my alley. And if I don't do anything about it, it would be really a shame. Ironically, I started a course this winter on health technologies and challenges with scaling those up, and drugs, devices, diagnostics, digital health, vaccines, and COVID-19. During COVID-19, we have failed on every one of them. Every one of them. Of course, we are working hard. There are lots of 100+ vaccine molecules in the pipeline, but there are a lot of challenges. Drugs, there are a lot of challenges. We failed with ventilators, and we failed with PPEs. We failed with diagnostic tests of all kinds. Not antigen tests, but also tests of various kinds. And I don't want to go into details of it. But it's just been a major failure for our society in addressing this crisis in an effective way. We have not come together as a global community to address this. We have gone our separate ways, and that's been a shame. Even within the US, our states have gone separate ways. Exactly what we don't need to do to solve this crisis, right? So that, I feel very passionate about it. So I've been advising innovators, both in India and the US, that are working on solutions for that. I feel that's an important role for me to play. I've been doing these videos to help communities think about how to deal with the crisis, both clinically, but also in terms of dealing with some of the fears that they might face, and so on. But also putting together a speaker series later this fall at Stanford, where I'll bring key thought leaders together. And then last thing that I'm involved in is coviddv.org, which is a massive information portal that brings together really curated pieces of information that are validated. So it clears away the fog that exists around COVID-19. And I think we're just getting started. I think next 2 to 3 years, we'll have to deal with this crisis in a very significant way, and we got to continue to work together on it. And what you're doing right now is actually a very helpful thing to do, Shankar.
Well, thank you. I mean, in all honesty, what I'm doing is more like a hobby. For you, it seems to be your life, because you're in global health, and at every level, from say ventilators to vaccines to medicines, and at a global level, you're talking about every country in the world, and Stanford and Path and your consultancy are all involved at the global level, and you're the chair of outreach, global outreach. So my question is, at an individual level, as you clearly said, we are privileged to the extent that we have the financial liberty to work on these things, but most people are not. How can individuals, what can they do to be able to thrive through this crisis? Because otherwise, it's easy to get into self-loathing, feeling like a victim. It's so easy to throw rotten eggs at every president and prime minister. That's not going to help. I'm not a big fan of every president and prime minister, but I know they're doing their level best in whatever way they can, because nobody wants destruction. But what can individuals do to be able to face in their own personal life and in the at a global level? Is there something you can offer there?
Yeah, I think there are three things three, I mean, there are a lot of things we can do, but I would say three primary things that each individual should do. And I'm going to say individual because we can, in this crisis, every individual must do what he or she can. So number one, first and foremost, keep yourself safe. Find a way to keep yourself safe. This is it's a virus that we don't really know very much about. There's a lot of uncertainty around it. There's a lot of health issues that could emerge from being infected by being exposed to this virus. So find a way to keep yourself safe. Find a way to keep yourself healthy, physically, mentally. That's number one. That's number one. Number two, find a way to sustain yourself. Whether it's your career, whether it's your education, whether it's your family, the well-being of your family, your loved ones. Focus on them. This is a wonderful opportunity to actually connect with your family. Most of us are busy professionals. We have jobs. No matter what level of career you are at, our lives revolve around that. Very little time of our life actually gets spent with the family, unfortunately, the way our society is set up. Whether it's education, whether it's our jobs, we spend very few hours, 2 to 3 hours with our family. This crisis is forcing us to spend a lot of time with our families. Make the best of it. Be there for them, engage them, focus on your work, get it done if you can, but also try and reconnect with your family, reconnect with your loved ones, reconnect with your friends through technology if you can. So that's the second thing. Just sustain yourself and kind of find a way to sort of plow through this crisis by sustaining yourself. So that's the second piece. The third thing is the theme of your the series that you have. Find things that you could actually do that you could not otherwise. Find a way to grow. Find a way to exceed what your life allowed before this crisis. So I know people that are actually doing courses online. A professional friend of mine who works in the medtech industry, he just did an AI/ML certification course. My brother, who's stuck here, he used to work in Saudi Arabia. No flights between Saudi Arabia and here, and he's stuck here because his son had an accident, and he's kind of working here to take care of him. But he can't even go back, right? So he's been doing courses. He's done like 3 or 4 courses. I'm so impressed. And he's become a PMP certified. He's doing things that he wasn't able to do before. This is something that he had in his mind. That he's been meditating. So find a way to sort of go beyond what you could do. So grow yourself. So find avenues for that growth. Because when you do that, you are not just biding your time. You are actually making it constructively count, and you are adding to the world as a result of it. So if you can add a little positivity in somebody else's life. So for example, I know somebody in my neighborhood who's been stitching these masks that she is giving away for free. And all she's asking is if they could donate to a charity of her choice. What a phenomenal thing. I have bought masks from commercial enterprises, but I've also gotten masks from her that I use. Actually, I do use them very regularly, and then I've given money to the charity. So, there are some remarkable ways. These high school kids I told you about, they've been doing 3D printing of masks or shields for healthcare workers. So there are things that you can do that allow you to grow beyond yourself. So those are the 3 recommendations I would have. And even kids can do that. Not just high school kids. My 3.5-year-old, I've been teaching him to sort of grow beyond. He can't go to preschool right now. So I was like, okay, let's see what else can you do during this time that you couldn't do before. So I think this applies whether you're old or you're very young. It doesn't matter. We all can do something differently. Rather than sitting and worrying about. So the only thing so those are 3 things they should do. The things that we should not do, the one thing that we should not do is feel sorry for ourselves, feel this fear of the unknown, because it is the unknown for everybody. It is the unknown for everybody. And life is uncertain as it is, right? So make the best of the moment that you got. You're lucky, you're fortunate that you're alive, that your family members with you. It could be much, much worse. It is much worse for a lot of people. So make what you have count.
Wow. I mean, this goes beyond philosophy. This is down to practical. We cannot anymore say be in the here and now, because we have to be in the here and now. We cannot escape to a beautiful future where nobody knows. So
Absolutely.
I'm so glad you're mentioning that, especially with children of adult, teen and a small one, and because you're involved both in the industry and the academia. And I'm so grateful you're mentioning these things. Do you have any other suggestions, or where do you see yourself going forward? Where do you see yourself continuing with the 18-hour days, 36-hour days?
Yeah, I mean, I was talking to Sukada, my wife, and I was telling her, I get so much energy from all of these interesting things that I'm fortunate to be involved in. I'm sure when I die, whenever that is, I probably would have a long list of things that I couldn't quite finish. My list keeps on growing. I think I'll continue to do what I've been doing. I'm getting more involved with Seva. I've just taken on an additional role there. I think my Stanford work is just building up further. My engagement with Africa is now expanding. So that's definitely going to be a key focus. My India work continues to move forward. We are in the phase 2. So I think it's, my Orbees as an organization is growing, and we take on projects at Orbees that are very future leaning. We are fortunate to be able to pick the projects that we want to work on, and we just finished a project with a very large medtech company. We are helping them think about what should the post-COVID game plan for them be, and how should they reframe the healthcare that is positive, that focuses on patients. There's an inverted U-shaped curve to healthcare. In 20s and 30s and 40s, when we were growing in India, for example, even here in the US, a lot of care was provided at home by physicians that either came to our home, or we went to them that were in our neighborhood. It was very personalized, and physicians kind of touched our pulse and sort of spent a lot of personal time with us. And with technology, a lot of that swung to hospitals, and healthcare became very impersonal. Healthcare is becoming very personal again, this time actually advanced by technology. And I think a lot of medtech companies and pharma companies should actually think about that and enable that, so that care can move closer to home. You can make them much more accessible, much more personal, what Eric Topol calls about deep medicine. I think we have an opportunity to do that. So, I'm really lucky to be able to do these different things. And I think I'll continue to do that for at least, a decade or so more in these areas, until a new opportunity presents itself.
I will not be able to recruit you to a dance class, huh?
Why not?
I get that from my friends saying, "Arey, all you seem to be doing is dancing." I say, okay, I will do something more serious, like interviewing people who are not dancing, or doing something quote-unquote
Dancing is
real.
very important. My 3.5-year-old teaches me that every day. He
Yes.
puts on the music and he dances, and it's just, we all dance with him. So it's a wonderful thing.
So I'm so grateful that again I got a chance to talk to you about so many different things. You mentioned something specific about the phase 2, that you are going to do something more in India and also in Africa. Is it possible you can elaborate on that? Because the world is, we in the United States have certain privileges. At least we have technology. We don't always have access to technology. That is probably the biggest challenge I see, the distribution of healthcare and the availability of healthcare, especially as you mentioned, in certain areas, in certain communities, there is definitely disparity. And that's not a technology problem, it's more a social issue. How do we make it accessible? But there are places in India where there's just no availability at all. And in Africa, similarly. So what are you, in what ways are you involved in these projects, and what do you see happening?
Sure. Yeah, no, that's a great point. And I think technology is a part of the solution. I do believe in technology bending the cost outcome curve and increasing access to care, but it's not a given. Often, the book I mentioned about deep medicine, Eric Topol's book about how AI/ML is going to advance medicine, make it much more personal, make the medicine deeper. But it's not a given, because AI/ML algorithms are built on data that has been collected from populations that have access to care today. So the populations that don't have access to care, there's no data. So future algorithms may actually be, you're going to quantify the disparities even further, right? So technology is not a panacea, but it can be a big part of the solution. So there are a lot of other things, behavior change, appropriate business models, appropriate sort of training, education that must happen to advance care access to those communities. So the things that I'm involved in, this is through Stanford, involved in educating, training, guiding, advising, mentoring medtech innovators in India in our phase 2, who are now building solutions for the underserved. About half of our mentees in India are actually working on technologies that directly impact the underserved. The others are working on technologies that have the potential to serve the underserved, but they're not ready for that right now. But the other half are directly focused on that. I'm also working on a rheumatic heart disease focus initiative, which trains the communities, educates the communities and healthcare workers, including the cardiologists, to sort of move those patients that have rheumatic heart disease in underserved communities and gets them to care. So those are a couple of things I'm involved in. But really, I mean, trying to scale access to care through mentoring these innovators who are working on those solutions. So that's a key piece of my work in India. In Africa, we are building a community of innovation programs that engage with innovators on the ground in Africa. Africa is much further away from where the US is and where India is. US is much further than India, but Africa is behind India and China in enabling these innovators. And I've always believed, and I did this at Path, that wherever there are problems, solutions are right there. So if you can engage local stakeholders, last mile health workers, community members, faith leaders, healthcare professionals in that country, I think this top-down approach of parachuting a solution from outside isn't going to work in these regions. We have to create that capacity in those regions. We have to engage them in creating that solution. We need to build capacity from outside, no doubt about that. We need to bring resources from outside, but it has to be rooted in the problem. This is the biodesign methodology, right? The needs have to be found on the ground. The folks that are going to work on the solution have to be on the ground, and that's a big focus of me in my work in Africa. I'm working with innovation programs in Africa through an organization called BME Idea Africa. We just launched that last year, and I hope over the next 5, 6, 7 years we are able to sort of take the community to a very healthy place where India is, and take the lessons we learned from India to Africa and create that capacity. Africa is a young continent. There's tremendous capacity. It's growing economically. It's growing in terms of education. I'm very optimistic about where Africa is going to go. Next 20 years are going to be great years for Africa. So in fact, that's probably what I'll do next 20 years.
I'm actually headed over to Africa after this. I came as I mentioned to you, I came here for my 32nd marriage anniversary. And now that my wife is heading back to the US, I'm going in the direction of Middle East and Africa. I've never been there. My family has been lucky, they've visited. And interestingly, on one hand, it's a young continent, but it's also the oldest continent where our ancestors lived. All of humanity came from Africa. Even our language roots are from Africa. It's hard to believe. Way before there was Sanskrit and Latin, which are very sophisticated languages, they could not have been the first languages. The sounds that we call human are from Africa. So there's much to do. And what I like about what you're saying is not only the feasibility of empowering at the ground level, but also the dignity. It should not be like we're giving a hand, we're giving you something. There is so much innovation, the music and the culture, everything. I'm a big believer that community empowerment is when each person says, I'm going to take care of my brother and my father and my sister and my child. And therefore, it's an emergence, Africa has given us so much, from minerals to music to dance to language and even our own DNA. Am I preaching to the choir here? I think I am.
No, you're spot on. I mean, it's a phenomenal land. I mean, every time I've been to that part of the world, I mean, to various countries within Africa, I've just been struck by struck by the potential, the possibilities. And I completely agree with you about historical roots of our humanity in that region. I do think our future is in our past, and Africa is that future. My hope is a lot of mistakes that we have made in the rest of the world, including in our country right here in the US, that we're going to be able to avoid making those mistakes as we create a new economy there. And Africa is, I'm very hopeful because even policymakers in Africa, even the governments in Africa are starting to become fairly engaged and fairly clear about their own role in deciding their future. Previous, era in Africa, a lot of mindset was aid and accepting aid, and we made a mistake of doing these handouts, which the mindset was wrong, and I'm firmly against that. I think we should help because we have the resources and we have the financial capacity to do that, but it cannot be by telling them what they should do with it. I think we should engage them. I think this feeling that we know better, that has to go away. They do know what they need. We just need to trust them, respect them, work with them as peers. We should learn from them. Actually, it's an opportunity. I would say there's this term called reverse innovation. A lot of stuff that we've done in India, we actually brought back to Stanford Biodesign. Stanford Biodesign has benefited from the work we've done with Stanford-India Biodesign. I have a feeling we're going to learn so much from what we do in Africa. We're going to benefit from that. Trust me.
Can you give any examples of things that were done by Stanford India Biodesign, which you were able to bring back, that would help and also encourage people in many other countries to innovate and not just look to the West for innovation? Can you are there any concrete examples you can talk about?
I can give a very specific example. I think in India, a lot of innovation, so at Biodesign, it's a design thinking based program, right? So identify unmet needs, invent a solution, and then implement it. For the longest time, we didn't really worry so much about the price of the device or the value of the device for the healthcare system. As long as there was a payer who was willing to pay for it, we focused on that. We continue to come up with innovations that improve the clinical outcome, but we didn't really have the value as an equation, as part of the equation. It was not part of the constraints that we focused on. India taught us how value must be a central piece of that. Value to the society, value to the healthcare system, to the government, to the payers, to the patients who are often paying from their pocket. And so in India, a lot of our innovation that our innovators actually came up with actually included that as a constraint very early on in the design process. Right from understanding of the unmet need to coming up with concepts and then taking them through implementation. And that has really been a very powerful lesson for biodesign. And a number of technologies that were developed in India actually now are finding place in the US. The fecal incontinence device that we came up with in India, it has actually gotten a really good traction in the US market. There's some phenomenal innovation around neonatal resuscitation that came out of India that it's a first innovation in 40 years that is actually now being brought to other parts of the world. So a number of these innovations are going to have tremendous impact outside of India as well.
Well, I'm so grateful you're talking about things globally and also engaging. I'm just wondering, with 3 kids at different ages, there is no way you can be a helicopter parent. Can you give us a little glimpse of how do you do parenting in the days of so much innovation? Maybe you invented a better way of doing it, remote control or something like that.
No, I've been fortunate actually. Both my older kids, Rishik and Shrutik, are fairly independent. They're very close to me and their mom, but they are fairly independent. My older one is, he's a very quiet kind of kid, and he lets me know when he needs help. And we have these deep conversations. He's a very quiet kind of kid, and he's very close to his mom as well. So we have very different relationships. And I focus on solving problems. When he has problems, he knows that he can bring that up with me, and he knows that I'm going to have a very constructive approach to that problem rather than saying, "Oh my God, you have that problem." I don't sort of start fretting about his problem, and he appreciates that. He's 21 years old, so he doesn't need me babying him. So So that's that. And then second one is my dad, actually. He's a chemical engineering student. He's very clear about what he wants to do. He's very driven. His schedule is busier than mine. He's involved in more things than I'm involved in. So I have to actually tell him to slow down. I tell him, take time for yourself and have a break in between. He is a dad to a 3-year-old, a 4-year-old dog himself. So he plays that role. He teaches me. I don't have to teach him. So I think that my little one is where I'm spending a lot of time because he needs me, and he, I feel, it's my second one said, Dad, all the mistakes that you made with both of us, maybe is a chance for you to fix that with this third one. It doesn't mean I didn't do a good job. He says, no, I don't mean that, but so I'm trying to do that.
Well, we've talked about everything under the sun, and thanks for answering them patiently as well as in great detail. Do you have any closing thoughts before we say goodbye?
It's been wonderful to. Sorry, go ahead.
And are there what's the best way that people can reach you? Because I'm a big believer, you are very much available on social media. If people have any questions, whether it's about Stanford Biodesign or it's about the global outreach work that you're doing, particularly in Africa and India, or if you have any suggestions on the high school work you're doing, how can people reach you? And we will include all the links. We'll include all the links.
Sure. I'm very, very accessible through social media. I do use my Facebook as one-to-many communication tool. I have friends on my Facebook who find my engagement there fairly useful, and many of the new things that I do. For example, there was an announcement from our administration, U.S. administration, about international students having to leave, being forced to leave if they did courses online and they didn't go in person. And I had some potential solutions for them, and I announced that through Facebook, and I was going to do this Zoom call with all of them. Fortunately, that decision has been reversed. But a lot of engagement happens through Facebook, so feel free to add me. I'll be very happy to add you as long as you can reference, this particular conversation that we are having. LinkedIn is another way, although I use LinkedIn a little bit less. It's more for professional engagement. Facebook is both, societal as well as personal. I don't use Twitter as much, so probably not. I mean, you can follow me there, but I post there occasionally, or Instagram. But I think so. Facebook is probably my primary means right now, and LinkedIn to some extent.
And we'll also provide the links to Stanford Biodesign as well as to the company where you are engaged in many different places. And everybody knows how to get hold of me. I will be providing my links as well. And if there's enough interest, because this is so topical, this is so relevant to the crisis that we are going through, whether it's whether it's the need for ventilators, whether there's a need for vaccines or medicines, then we will have another follow-up call. I know you're super busy, but I think it is necessary for people to feel that comfort that some real things are happening around the world, not just in the US or in Europe, but innovation is happening around the world, and we are all in it together, doing different things, but we're all in it together somehow. So any other questions or comments before we say goodbye to our friends who are listening to us?
And the only thing I'll add, we had a pretty wide-ranging conversation. I just want to thank you for doing what you're doing. We need to be constructive. I often worry that when I'm posting on my Facebook or LinkedIn some of the challenging pieces of information that come out, I wonder whether I'm adding to stress of the folks on my. I do feel the necessity and importance of keeping everybody informed. I do post some positive stories that come out in terms of solutions as well, but we need more communication mechanisms and sort of pieces of conversation like this one, where we are having a very constructive dialogue. And I do think that what you're doing is very, very valuable. So thank you for doing this.
Thank you. And I mean, each one of us is doing the balancing act. We don't want to paint an overly optimistic picture based on false, or we don't want to become Pollyannas. We want to be totally realistic. I see myself as an Alice in Wonderland, going through blind alleys I've never seen. You know what I mean? I see
Absolutely.
myself and I see you as going through an adventure where we are going to see people dying. We're going to see, or like Harry Potter, July 30th is his birthday coming up soon. My son is also that week. And so, yes, we are the Hari Puttar, as they say in India. It is necessary to be able to face reality, but we have to be aware that there are mines and potholes along the way also. So
Agreed.
again, thank you. And again, if there's any way we can improve our communication to people, and we want to hear back from you, if there's any way we can be helpful, Anurag can be helpful, we are there to help.
Thank you.
So
Thank you,
thank you.
Shankar. Yeah, thank you. Bye.